We have been very disciplined in following our plan. Today, we are announcing that Phase 1B, Tier 3, will be activated on Monday, March the 15th.
Breaking news at 6:30, Governor Mike Parson has announced the official date for the next vaccine phase in Missouri.
Phase 1B Tier 3 will focus on employees working in certain jobs such as teachers and government employees. We'll have more on that in a few moments.
As coronavirus vaccine distribution continues across in Missouri, we have been listening to the questions that you have on the rollout process.
We're taking the next half hour to discuss your most asked questions with local health officials on the vaccination process. Tonight, we're covering who's now qualified under Tier 3 of Missouri's vaccine rollout, what you can expect when the Johnson & Johnson vaccine becomes available, and how distribution has recovered from recent extreme weather delays.
Tonight, we are joined by Sarah Hum with the Columbia-Boone County Health Department and Vaccine Committee Co-Chair Dr. Margaret Day with MU Healthcare, and then Deputy Executive Director Brent Gann with the Missouri School Board Association is also joining us tonight for the first part of our discussion to walk us through Tier 3. Thank you so much for joining us tonight. We appreciate your time, especially on a day like today. And the first question we're going to go to is for Mr. Brent Gann. Some exciting news, especially for teachers today. They're going to be eligible in this next phase, Tier 3. What are your general thoughts today on this announcement?
Well, we're very pleased with Governor Parson's announcement that teachers will soon be eligible for the vaccine. I know teachers have been anxious for this announcement to protect them from the virus as we move forward. You know that teachers have been facing very high stress levels here during this school year across our state, adapting to this environment, teaching virtually in some cases, teaching in a hybrid. Many teachers are back in person right now in many of our school districts across the state. Many of our students are back in person. So this announcement, I think, will give teachers some additional confidence. We'll be able to keep teachers in the classroom where they need to be. We'll be able to keep students in the classroom learning in person. And that's a very positive development. You know, so many of our districts have been faced with shortages of staff, and shortages of substitute teachers as well. And so we think this is a really important step forward to keep our teachers in the classroom and keep our students learning in person.
Dr. Margaret Day with MU Healthcare, what have your conversations been with school districts locally? They're a huge employer really across the state of Missouri. Anything that we can expect to see working directly with these districts when the time comes?
Yeah, at MU Healthcare, we are following, state guidance and using the current eligibility criteria for folks. And so, certainly when the state allows us to move into that next tier, we'll be ready to do so. We're certainly partnering up with Boone Health and with Columbia-Boone County, Public Health and Human Services. And this vaccine effort is absolutely a team effort. So we'll be all working together. No doubt.
And Sarah Hum, this question is for you. The governor specifically said earlier today in his news conference that he wanted to wait until March 15th to activate that Tier 3 to give some local counties time really to prepare for this next rollout. So in your eyes, what needs to happen for Columbia-Boone County really to be ready for this next phase, Tier 3?
Yeah, one of the main things is that we continue to have issues with vaccine supply.
Sure.
And so, I think I'm glad that we have an additional 2 weeks to before that Tier 3 opens up, and we hope to be able to vaccinate more folks who are in Tier 2 and focus on those at-risk folks before that opens up. But, one of those main struggles right now is just vaccine supply. And I would echo what Dr. Day said, in that we will continue to work with our local partners to make sure we're getting folks vaccinated as it's available.
Brent, what's the most important thing that healthcare providers should keep in mind when trying to work specifically in the K through 12 education world on making sure these vaccines are available to them?
Well, and I would echo what's been said. I think it's definitely going to be a cooperative effort, and I know our school districts have been in close contact with their local health departments up to this point in terms of making decisions on how to proceed with school this year, whether it be virtual, hybrid, or in person, and have relied heavily on data and information from those local health departments in making those decisions, which have been very difficult decisions to make this year. And I'm sure that that will continue as we approach March 15th and the rollout of the vaccinations for our teachers and other folks in the Tier 3 level. So yeah, again, it's going to be a very close working relationship, I'm sure, but I know our school districts are very interested in getting our teachers vaccinated as quickly as possible, but we'll have to work through that process, and it won't happen all at once. I'm sure that it will take some time to get that accomplished.
Sure.
But again, I'm glad, we're very pleased from our standpoint that that we see that on the horizon now, that we're going to be able to get our teachers vaccinated and keep them in the classroom.
Sure. And one of the big things, I think, and the reason as to why we are moving into this next tier in a couple weeks is the Johnson & Johnson vaccine. And if that does get approved for the emergency authorization use, it's already been considered, safe and effective by the FDA this week. And Governor Parsons says he expects, if it gets passed, 50,000 doses to really be in Missouri. And that's obviously going to help with the vaccine distribution plan. Sarah, this one is for you. I know this is early on because it was announced today and it's been a busy day for you. But what is the plan looking like, or what's the conversation been for when and if that does get approved and what that's going to look like?
Sure. So, we were all interested to see what the governor would say today about that, because more vaccine in our community, the better, to get folks a vaccine who wants one. And so, as the governor said, though, it seems like we'll have a decent amount of supply of Johnson & Johnson up front, and then maybe not as much immediately after. But, obviously our team is working together with the other local vaccinators to figure out how to prioritize if there are some groups that may be better suited for the Johnson & Johnson. For example, there's been some folks advocating that people experiencing homelessness would maybe be a good group for that, because it may be hard to get them back for a second dose. And so we're still working on those logistics and figuring out what that looks like.
So that's a good point. I want to ask this of Dr. Day. We've got 3 products that might be on the market here soon. Will people know which vaccine's available when they sign up? Can they pick? Because some might prefer that Johnson & Johnson vaccine since it's one shot.
Yeah, for now, I think, whichever vaccine we receive and is available to folks is the right vaccine for you. And so honestly, they're certainly still waiting on the emergency use authorization for Johnson & Johnson. But as you mentioned, safety and efficacy is looking excellent for it. So expecting, word more officially over the next few days. But certainly, vaccine supply versus demand is our greatest challenge right now. And so vaccine that becomes available, whichever brand, I think is they're all excellent, and people should really feel empowered to feel good about whichever one they're able to get.
Sure. And Dr. Day, also, Tier 3 doesn't just include teachers. We're talking about another large group of people that are qualifying under that tier. Are you working with any other sectors or employers that also qualify under this exact same tier?
Yeah, as you know, MU Healthcare has been designated as a high throughput health system and vaccinator in our area. And so we really are just following the state criteria for vaccination. Our efforts right now are, in one location, having people come to us into the vaccine to receive that. And those efforts will be ongoing. Certainly, we plan to, continue to send out invitations to really match the vaccine supply that we receive. And we'll continue to do that until, everyone who would like to be vaccinated is able to do so, including, those that become eligible here in middle of March from the state.
All right. Thank you all very much for your answers here. Stay tuned, though. We'll have more questions from some of these panelists here. We'll take a look at what you can expect after getting vaccinated and efforts to vaccinate homebound Missourians. That's next.
We have some breaking news right now. President Joe Biden has ordered an airstrike against Iran-backed militia in Syria. A Pentagon official says the U.S. attacks destroyed several facilities at a border control point.
The U.S. was retaliating for a rocket attack earlier this month that killed a civilian contractor and hurt a U.S. service member. We'll continue to follow this story and update you as we learn any new information. Now, if you're just joining us, we are speaking with local health experts tonight on the coronavirus vaccine and your most asked questions on its rollout. We'd also like to welcome Labia Butler, the new supervisor over at the Keene Family Medical Center in Columbia.
We're going to turn our discussion now to vaccinating homebound Missourians and how distribution has recovered from last week's severe winter weather.
This question will be for Sarah Hum over at the Columbia-Boone County Health Department. Can you explain the plans put in place to help vaccinate qualified Missourians who are homebound?
Yeah, so one of the things that the health department really wanted to focus on is breaking down some of those barriers that folks have to getting a vaccine. And so one of those things is folks who can't physically leave their homes or have a really hard time doing so. And so we have created this kind of program to vaccinate homebound individuals where they can call our contact center at 573-874-CITY, which is 2489, express their interest, leave their information to contact, and we'll work on getting people scheduled. Today was actually the first day that we vaccinated homebound folks, and we did 8 in one day. Obviously, there are some logistics to go into that with driving to individual homes and staying the 15 minutes for the observation period. But we hope that this will provide an opportunity for folks to get vaccinated who physically cannot get out to a vaccination clinic.
And by chance, do you know how many people have signed up or are interested in this right now?
So in the first week, we had over 100. I'm not sure exactly what the number is right now, but it's certainly over 100 folks who have expressed interest.
Okay. And this question is going to be for Ms. Butler. What are nurses looking for when patients are getting inoculated with the vaccine?
We are looking for any opportunity for our patients to receive the vaccination. We are definitely trying to get rid of challenges that are causing our patients to not be able to have access to the vaccine, who would like the vaccine, like just lack of resources, internet access, no computer access, maybe no cell phone access. There's transportation issues as well. And us as a MU healthcare community and our physicians and also leaders know that there are some resources that our patients, are lacking. And so we are working with, Boone County Health Department along with Boone Hospital to make sure that every patient who would like to be vaccinated is vaccinated. MU Healthcare also has a telephone number for those patients who do not have access to the internet, and our number is 573-771-CARE, and that is 2273. Please feel free to reach out to us, and we can help you get your survey filled out so that you can be on the list to receive your vaccine. We want to vaccinate everyone who would like to be vaccinated.
And Ms. Butler, there's been some talk in this community lately about minority access to the vaccine and talking about skepticism that may exist in minority communities about getting the vaccine. From your personal experience as a nurse and also maybe in just conversations you've had around the community, why does this skepticism exist and what's being done to maybe try to address it?
I really think the issue is lack of education in regards to the vaccine, and then also just being misled by others who may not really have the answers. I would say maybe some social media posts that are just not true. If you really, would like the information, the true, real information in regards to the vaccine, please go to the CDC website or reach out to your primary care physician to receive accurate information. I do know that there's some skepticism as well around, I've heard, the words of being a guinea pig. Mm-hmm. African Americans are just, there's some distrust there because of some inequalities in healthcare in the future. But like I said, MU Healthcare, we understand that there are some barriers and there are some lack of education.
Sure.
There are some challenges, and we are here to help you.
All right. Thank you very much for those answers. We'll continue this conversation later on in the show. Welcome back. If you're just joining us, we're speaking with local health experts tonight on the coronavirus vaccine rollout.
Right now, we're going to turn our attention to delays with vaccines because of the winter weather that we just experienced, and also symptoms that could possibly happen when you're getting the COVID-19 or coronavirus shot. Sarah, this question is for you. How has the vaccine distribution recovered from the weather delays that we saw last week?
Yeah, so we did not get the doses we expected last week. However, we did get those for this week, in addition to the allotment for this week. And so we have gotten the doses from last week and this week that we expected to get. So we are currently on track and don't obviously expect any more weather delays since it's nice weather now.
And finally, for Labia Butler, we got about a minute here. As a nurse, I'm sure you've seen a lot of patients come through giving shots for the vaccine. What are some common side effects that you've been seeing over there with vaccinations?
So I have received my vaccination, and I really didn't receive many. I didn't have many side effects at all. So I don't think that there's much to be afraid of. You know, maybe a increased temperature, feeling a little fatigue. Those symptoms shouldn't last more than 24 hours. So that is definitely not a reason not to get the vaccine. I would really love for all of my loved ones and for my community to all receive the vaccine, just to keep us all safe and so that all of our family members can make it to the dinner table.
I love the firsthand account. Thank you very much, Labia Butler, Sarah Hum, for joining us tonight.
We'll see you back here later tonight at 10.